Hello and welcome to the Headache Doctor Podcast. I'm Dr. Taves, and it's my mission to empower everyone with headaches and migraines to break free from a life of fear and dependence and thrive in everything you do. And in today's podcast, I'm excited to have a fellow physical therapist who is passionate about headaches and migraines, who also has her own personal story, as a guest. So thank you, Jacqueline, for being on the podcast today.
Yeah, thanks for having me.
Yeah, so Jacqueline is actually, Dr. Stoerzbach is the newest member of Novera Headache Center. So if you fly out to Colorado Springs, or if you're here local and you want to get treatment, you have the option of seeing me, Dr. Taves, or Dr. Stoerzbach. So this is an exciting moment in the history of Novera Headache Center as we are growing and expanding and helping more people. So Jacqueline, let's start off with you just telling a little bit about your story personally with headaches.
Yeah, so my story is a little interesting. I think around the age of 6 or 7, I was playing flashlight tag in the backyard with my older sisters and neighbors, and I was one of the younger kids. So a little smaller than everyone else, and we used to hide in the grass at nighttime and then try to find each other with flashlights. I don't know if other people know that game, but so I was hiding, and another bigger kid just came kind of running across the lawn, didn't see me, and just like full kick to the side of my head, pretty hard, and it was just like instant headache. I remember going in and telling my mom and crying and not understanding, and it just felt awful. And that was like my first experience. And then since then, I kind of remember headaches ever since then. And then when I hit puberty, especially, I really started to get more of a migraine type symptom. And then it's always kind of been on this right side primarily. Okay. All right. Yeah.
So from that sort of traumatic, the kid kicked you in the head onward, how frequently? I mean, is this something that like you had to cater your whole life around, or was it just like once every 6 months?
No, it came to a point of catering my life around it. They probably started, a little bit more infrequently, but again, by the time I was 12, I was probably having at least 3 or 4 migraines, or 3 or 4 headaches a month, and at least like one big migraine. And then through college, even especially with extra stress and grad school and all of that, it was one of those things that I was regularly taking ibuprofen, just trying to get through my day, and like kind of nervous about big events because you never knew if you're going to have a headache or not. It's amazing what you can push through, but it really was, it's a life-changing thing.
Yeah. So I'm sure a lot of you listeners are hearing that and you're like, wow, okay. So Dr. Taves has not experienced migraines. I have had one scenario where I was flying and the pressure change in the cabin triggered what it felt like my head was going to explode. But Dr. Stoerzbach actually has this personal experience of having at least one migraine a month and frequent headaches. So a lot of times patients come into the clinic and they just feel hopeless and frustrated because they've seen provider after provider and no one's really been able to explain what's going on. So bring us into like, as you're going through treatment and trying to find a solution, like what did you feel and what were your interactions with providers?
Yeah, even in high school, I remember my parents trying to help me find a solution, and they would take me to the doctor who would just maybe prescribe medication. I would remember them taking me to a chiropractor, and I did that for a while, but it wasn't very helpful. And then I remember, like, in college, I tried acupuncture, and then more doctors, because I kept moving cities, new doctors. Okay, maybe let's try this other medication. But I was still reaching for the ibuprofen constantly, it felt like. And then it got really frustrating when I was at my own in PT school. It's like I couldn't figure out the problem, and I couldn't find others around me to figure out the problem, and so that was really frustrating. It was definitely hard with doctors. They have such short time with you, and there were just so many times I felt really dismissed, like, oh, well, you're just another young female we've seen with headaches, and no big deal, take some meds, it'll be fine, with no actual solution. And so that gets really frustrating. And the acupuncture and the chiropractor, I would actually say helped more, but it was never long lasting. It was never like, oh, this really made a change long term. And they were, those types of providers, they get to spend more time with you, so a little bit more understanding. But I just never felt like no one ever explained it to me, or they would just say, let's try to find your triggers, and then I felt like everything could trigger me, so I could never pinpoint it. Is it food? I did the whole food diary thing. I remember even one doctor had me check my glucose levels, like actually pricked my finger for a while because they thought it was a glucose thing. It wasn't that. Yeah, and I just felt like I went round and round. I went to the eye doctor several times. They were convinced, it was my eyes, got new glasses. Oh, that should be better. No, it's not better. That sort of thing. So I feel like I went through a lot, and not until recently I feel like I've actually gotten a handle on them.
Yeah, so experiencing headaches and migraines, and you say in PT school, that's when it really got frustrating.
Yeah.
So were headaches and migraines the reason you decided to pursue physical therapy and then someday work at a headache center?
That's interesting. It really wasn't my impetus for that. Now, obviously, what's interesting is even as a PT student, I never thought of migraines as a PT specialty, which is just really sad. I remember I played sports in high school and I'd hurt myself and I had to do some rehab for my back and an ankle at one point. And I just remember that was actually my impetus. I loved working with the PTs. And I just remember thinking I want to kind of combine science and art together, and it just kind of seemed like a really good avenue. So that's actually was my impetus. What's so isonic is yes, during PT school, I thought, well, maybe I can find something for my headaches, but I never did. And I never even, I never found the right person, the right teacher, the right professor, anyone who could really feel like they could help me.
Okay. All right. So you're going through school, you're going through PT because you're excited about healthcare. Mm-hmm. You've seen, so who all did you see? Primary care, neurology, acupuncture?
Yep. So primary care, eye doctor, acupuncture, chiropractor. That's probably it. But several primary cares, because again, I had been moving some and trying to find different doctors, and it was all just about different medications.
Yeah.
Or, they say, oh, manage your stress. Well, everyone's trying to manage their stress.
Yeah.
And you try all the things in yoga and, Epsom salt baths. And yes, that all can sometimes help, but again, it's not getting at the source.
Yeah. So going through this as a kid, ever since the kid kicked you in the head,
Yeah.
moving onward. Is this something where you knew people around you that also had migraines, or did you feel alone in this? What was that like?
I kind of did feel alone. But what's interesting is over my life, I've met more and more people, and my oldest sister also suffers from headaches and migraines. And so that was one thing that I felt like she always kind of understood. Whereas everyone else in my family and my friends who had never really experienced headaches or migraines, I think, you definitely feel alone because you can't see the pain. No one understands the pain. So maybe it's made up. Maybe it's in your head. Maybe you just have a low threshold to life or something. And you're like, no, there's really something wrong. I'm just not sure what it is. And it can feel really isolating.
Yeah, absolutely. So many patients, I think, are going through this process sort of shying away from speaking about it. Initially, mm-hmm. as the pain starts, you think, okay, this is a problem I need to solve, and there's a solution out there. Mm-hmm. I just need to find it. And the more providers you see and the less help you find, the more you just think this is something I just have to deal with. Is that correct?
Yeah, absolutely. You start to think you become hopeless. You kind of just think this is just who I am. I guess this is just the cards I've been dealt, and it's just part of who I am. I'm going to have to suffer however many days a month for the rest of my life, which just isn't true. I really, truly realize that now. But even as a PT, I had so many moments where I'm it's, this is just how my life is going to be.
Yeah. So I'm curious, as you're seeing these doctors, did you tell them, oh yeah, I was kicked in the head and then I had a headache?
No.
Okay. All right.
What's interesting is not until the last few years did I remember truly thinking about when was my first headache that I really remembered the incident and really correlated it. I kind of always just thought I was a kid, you eventually feel better. It's no big deal. You're malleable. But when I really think about it, I had never experienced a headache. And I mean, it was instantaneous, which now that as a PT, I realized was an actual injury. It was probably a small concussion, but I just didn't know that at the time.
Yeah.
And so, I never talked to my providers about it. I would definitely, the whole, once you hit puberty, the once a month menstruation thing seemed to play a role, but I would get them without that also. So that would also kind of be a scapegoat for some of the providers, just, once a month, preventively take some ibuprofen, you'll be fine. But that really wasn't the whole story.
Yeah. So for all of the moms and dads out there who have kids that might be, one category is if they have headaches. Headaches are never normal, and especially if they have migraines, you have to take that into consideration of, kids are very active and we play, and it's natural to fall or trip or get hurt or get kicked in the head. And so it's we always need to understand that the body can sustain these injuries, and oftentimes we need to actually treat these joints and the structures that are especially stabilizing our 12-pound head on our neck, as that is more likely to or more susceptible to these injuries. So it's interesting, Dr. Stoerzbach, that you didn't necessarily connect that until you started to realize, like, oh, this is a neck problem.
Absolutely. I mean, it's so, and I always was one of those, like, you'd rub your neck a lot and you kind of would always feel it kind of starting at the neck and then eventually wrapping around. And so, yes, in a way, I always knew it was my neck, but I never understood how to isolate the right part. Because, yeah, you could do some general stretches and get a massage and maybe it would help for a bit. But again, it wasn't really pinpoint enough to get to the root. And now, that I've learned enough, been trained enough, have enough experience in working with you, is the first time I have a handle on it. That I can really, go through life and feel like not every trigger is going to get me, and I can really manage and enjoy my life.
Yeah, so one of the things that people ask all the time is, do you know someone near me that can do this? Mm-hmm. And I, with everything in me, want to say yes. But the problem right now is it's just kind of this gap within our healthcare system. Mm-hmm. And physical therapy is not addressing this problem, and it comes from a few different sources. But I think your story is interesting because you're a very experienced manual therapist, physical therapist. And so tell me a little bit about, from PT school onward, what were some of the things that you pursued, the things that got you excited? What was your experience? And was that in headaches? And coming to where we are now, if you feel like there's a gap, why do you think that gap is there?
Yeah, so kind of going through my story, I got out of PT school. I first took a job in a hospital and then quickly kind of moved to an outpatient setting. And since then, I've always really focused on outpatient and hands-on manual work, which I absolutely love. And I've really kind of developed, I've taken multiple different approaches and different courses to kind of combine together. I will say after 2 years, I took my certification in dry needling, and that was one thing that really changed the game as far as my treatment with patients, and then even myself when I was able to be treated by my coworkers, that actually did seem to get at some of the trigger points and root causes. So that was a big thing I brought in. And then, as I went on, I would see a lot of different, I'd see a lot of shoulders and backs and head and neck. And it was interesting. I really feel like I've kind of dove into the shoulder more and got a little bit more expertise in that and noticed the correlation of shoulder to TMJ to neck to head. And how, that interrelates. And definitely the last year, what I was seeing a little bit more, because in my last clinic, it seemed like I would kind of get more of the chronic pain patients, kind of the people that no one else wanted to see. And so I feel like I got really good at understanding chronic pain, and then also understanding that chronic migraine pain. And obviously with my own story, really trying to dive deep of how do I help these people the most, and not until, again, diving into the neck and then becoming really efficient at it have I been able to make a change. Yeah, so
we've been working together now for 2 weeks, and Dr. Stoerzbach is diving in, and patients are liking her better than me now. But I want to ask, out of the patients that we've seen, and you've heard their stories, are those patients that you have found in other clinics, or is this a unique population that we're treating?
No, it's definitely unique considering that's really all we do here. Before, it would just be intermittent when I would see them. I love that in this clinic, it is all we do. It is all we see. We hear the similar stories. Now everyone's story is different, but, those same stories over and over again, and it's the same hopelessness that comes in, and the same people, though, that we can get them to walk out the door and realize there's so much hope and they're going to feel better.
Yeah, so coming to the place now where you have your own personal experience of treating headaches and migraines, and we're getting excited about, oh my gosh, this is something that I've found relief with and I can help other people with. One, how do you personally feel knowing there's an answer. And how exciting is it to help other people in that?
Yeah, no, it's life changing. I feel like I have my life back, and I can like enjoy my hobbies and my evenings. I used to go home, and just feel so tired or fatigued from my low grade headache all day. It's like the whole evening was shot. Now I can like really go home and cook dinner and play with my dogs and go outside and chainsaw some trees up if I need to, and all the things, which is awesome. And the fact that like I'm just happier. I'm easier to be present with the people around me that I love, and give back more to them, which feels so good. And now I can give all of that back to my patients during the day. Like if someone gets up and walks off and feels better and they have more, they're more empowered to just thrive in their day. It's like the best feeling.
Yeah, I love that. So, trying to solve this problem, right? Because there's a lot of people that suffer with headaches and migraines. In your opinion, why is this not something that is readily available within healthcare?
Yeah, that's a really good question. To be honest, I think one thing is either people are too generalized or too specialized. Meaning the generalized like PT, again, just doesn't see enough of this specific area. In school, there's not enough specific training on the head and neck. And then unless you truly seek it out and find a mentor and have an interest in that, it's not something normal PTs are going to become efficient with. Now in the specialty, I mean more about like the other types of providers, right? Like the neurologist. There's always these very specialty people, but they're kind of like missing the big picture. And again, you can kind of be bounced around a lot. And I just think there's this huge gap that somehow has been overlooked. And most providers, most doctors don't have the orthopedic hands-on work. They don't know how to assess the neck properly. And that's not a fault to them. That's just not in their training. They just don't do that. And so I think, their first thing should be go see a PT in this specialty, assess your neck properly. That's probably the root of your headaches. I mean, I think that should be like frontline every time someone comes in with a headache.
Yeah, it's actually, I think a lot of people listening to this can relate, but I think if we were to stop and listen and ask probing questions, even your story. So how long did you suffer with headaches and migraines?
I mean, I'm 32 now, so like 27 years probably.
Yeah, so 27 years. And so let's say year 2 into having headaches, you go to that primary care doctor or whoever it is. And if they stop and just ask specific questions and listen, they would know your first headache was when a kid kicked you in the head.
Right.
Right? And then intuitively you think, well, your head itself is the skull it's a bone. It's something that is not necessarily going to be compromised. And if it is, we'll find out an x-ray. But the neck, what happened to the neck during that injury? And from there, we can get you the appropriate treatment. And so oftentimes it just comes back to listening and understanding that the neck can be a problem in the first place. But, you, the patient, oftentimes people do not associate their symptoms with head and neck pain to whatever injury they sustain. Because even sometimes the injury will happen and then patients can have the symptoms that pop up later. But I think your story is really interesting because we could have solved 27 years of headaches and migraines if we could have solved that neck issue right away.
I know.
Yeah. And so as providers, Dr. Stoerzbach and I, we want to send that message of, hey, let's treat this early so that we can spare you from decades of headaches and migraines, those lost days to migraines that hit at the most inconvenient times. So what's kind of an important message that you want to share to fellow headache and migraine sufferers, and hopefully people that are through what we're teaching them will no longer suffer? So
I mean, the first thing is go find treatment that works, like Novera Headache Center, as soon as possible, because the more you wait, the harder it is to treat. The more things that can pop up that kind of muddy the waters. And so truly just find a clinic that can do what we do. Second thing is, if you have kids, don't pass it off like, oh, they're just a kid, it'll go away. They're resilient, which they are, but don't overlook that. And the earlier you can get them in, we can set them up for a much better few decades. Yeah, is that kind of what you were thinking?
Yeah, absolutely. All right. Well, awesome, Dr. Stoerzbach. I really appreciate you, joining the practice and the effort of helping people with headaches and migraines.
Yeah.
It's a mission we're on, and it's a big mountain we're trying to climb, but one person at a time. And you guys can help us with that by sharing this podcast, writing a review, subscribing. And then if you are suffering with headaches and migraines and you're listening to this and you're like, hey, these guys can help me, then I want you to schedule that virtual discovery visit, or if you're in town or can get here, then I want you to come into the clinic so that we can help you through this journey, because there's a good chance you don't have to suffer anymore. And again, this is the Headache Doctor Podcast. I'm Dr. Taves.
And I'm Dr. Stoerzbach.
And it's our mission to empower everyone with headaches and migraines to break free from a life of fear and dependence and thrive in everything you do. Thanks again for listening.